into the room.
Good afternoon. My name is Dr. Olokayode Komolafe.
Hi, doctor.
Are you? Thank you. I guess you had a. Could you please tell me your full name, please?
My name is Angela Schrute.
Oh, all right. I guess you are the mother of our patient, Dwight Schrute, right?
That's correct. Dwight is my son.
Oh, thank you. Just for confirmation, how old is your son?
He's 15, doctor.
Okay, you are right. I've just been notified that he needs to have his IV cannula reinserted because of an issue. But
No, I'm not going to allow that. I'm not going to allow that anymore. They have been repeatedly pricking my child, and I'm not going to allow that.
oh, sorry about your experience. It's a valid experience. Your reaction is valid, but this experience shouldn't have happened. But do you know the reason why he's currently taking IV cannula?
I know all that. I know he has a chest infection, but you see, my son Dwight, he has cerebral palsy. And I understand that, it might be easy for you guys to go and, use everybody as your lab rats to learn procedures. But my child has cerebral palsy, and if you keep pricking him like that, he has been undergoing so much distress. I'm not going to allow that anymore.
Sorry about your experience, but let me ask you a few questions, please. For how long Dwight was born with this condition, right?
Yes, he was.
Okay. Hasn't been admitted in the hospital before?
Yes, indeed. This is like his fourth admission with this chest infection, and I've been going through this experience all the time, and now I can't see my son in so much distress.
I quite understand the way you feel, and most people in your shoe will also feel the same way. But this is, you know, the reason why we want to give him this IV cannula instead of giving him fluid or other things through the mouth.
I know it's for injections, but I understand he needs to get antibiotics. But like you said, you can give him antibiotics through his mouth. You can give him some tablet, give him syrup. There are so many ways you can give him antibiotics. You don't have to put in an injection anymore. Please don't.
You are very correct that we can give antibiotics through different routes. But because of the peculiarity of his conditions, the kind of antibiotics that he needs to take has to be given through IV. Is there any, and you said the team has managed to set the line unsuccessfully before. Is that any other reason why you want to, is there any other reason why you don't want him to have this condition, to have the IV line?
No, doctor, there is no other reason. I just can't see my son go through that again. Please.
Sorry, I'm deeply sorry about your experience. If because of the pain of injection, we are going to make sure that this time around we do something about it, that he will not feel the pain. Do you understand me?
What can you do? What can you do for him?
Thank you. We are going to numb the area such that he doesn't feel the pain. He will just feel that something is entering his vein. He will not feel the pain. That is one. Two, we are going to, I'm personally going to make sure that someone is stationed for that purpose, to prevent things that are likely to make the IV cannula damage on time, which will necessitate another one. So this one that we are going to set is going to stay for the appropriate period of time for him to receive this antibiotics.
All right. Yeah. Okay. Okay. All right. But
Okay.
try to make sure that they get it in first attempt. If he misses it, if they don't get it this time, I don't want it to be done again. I'll give you one chance, and that's it. That's it. I cannot have people coming and poking my child.
Thank you for your understanding. We will do everything this time around to make sure that the pain is controlled. That a very experienced phlebotomist will be the one that will set the line.
You do understand my child has cerebral palsy, right? I mean,
Yes.
you can't just come in and cause so much distress to a child who can't even communicate how bad this pain is. I cannot tolerate this. I want to make a complaint.
So,
I cannot see this happening again. Every time I come to the hospital, this is the same story every single time. I want to make a complaint.
sorry about that. How is his condition? How is his chest infection right now? Is it subsiding? There's no more fever, and is it better than when he was admitted?
I think it's the same. I think it didn't go any down.
Okay, all right. I'll quickly examine him and make sure that I'll do everything possible to make sure that he's much better. The IV cannula is blocked, so we are going to restart. Remaining. And he's having temperature, and because of that, and the heart rate is also increased. It means that he needs to take more of IV antibiotics for a period of days before we switch over to oral. So these are the things that we are facing now.
I understand, doctor. I understand where you're coming from. And as a mother of child who has these problems, you need to understand where I'm coming from. I can't put him through all this much pain.
I understand
and you. I want to make a complaint. I can't have this happen every single time I have to come to the hospital. You understand this is my 4th visit, right? 4th time I'm coming to the hospital.
I understand you. Now, I'm going to raise an incident report so that this case will be investigated. Other people, everybody that's involved in the management will learn from it. And it will help us so that this kind of case will not be repeated. And if you want to make a formal complaint, I will liaise with you with a patient advice license officer who will take formal complaints about it. The hospital will investigate about it, and we will let you know the outcome of the investigations. Meanwhile, I'm going to link you up with a support group for people that have this kind of condition, cerebral palsy. That I'm going to give you NHS website where we can read more about care of cerebral palsy, and because they are prone to things like this, they are prone to recurrent chest infections. Do you understand me?
Why is this? Why, doctor? I don't understand. Why is he having these chest infections? I mean, it's so often that he has it.
Because he's prone to swallowing problems. That's why it may go into the wrong. Move on to the next station.
All right, doctor.
Move on to the next station.
All right, doctor.
Thank you.
So this is an angry patient, as you might have seen, and angry patients are very difficult. So good job on trying to handle the angry patient. So I just want to give you a little idea about how angry patients can be. So angry patients, there are 2 types of scenarios for angry patient, where they can be angry from the beginning or after disclosing a news. So this is a case where the patient was angry from the beginning, right? So you will not have a chance to have a proper conversation with them at all. They will be screaming at you as soon as you start entering the room. But there are other cases where it's like a medical error, or you have misdiagnosis, or you've lost a sample. So in these cases they won't be angry but in the beginning, but as soon as you disclose the news they'll become angry, right? But you need to do enough data gathering. So in this case I would say that you didn't do much data gathering. Like examiner, have you? All right, so we have the examiner's checklist as well, so we can see through that. So a couple of data gathering points need to be added. So we have it over here. You confirm the name and the relation to the child. You did say the current thing, and you asked for if there was any previous history. That was a good thing. But you need to understand for yourself. You've understood from the case that this was a blocked cannula, right? But you have the patient in front of you, you have everything. So you need to understand how the patient is doing by examining them. You need to understand from your, experience of how bad this scenario is. right? So the examination part you never even came to. You were asking the mother, is the fever subsided? How did she know? How would she know? Like she's not the one taking the temperature, right? So if you see, ask about the number of cannula attempts. You never asked how many attempts you've had, right? Like why is she so frustrated? How many attempts have there been for her to get so frustrated? Like those are some of the questions. Like what were the symptoms that Dwight was having when he had these when he was admitted, right? And just a little bit about the history of admission, and inquire about Dwight's medical history. So you also, he has cerebral palsy. He's been having recurrent infections, but does he have any problems? Why does he have recurrent infection? So basically, he has scoliosis along with cerebral palsy. So, because of the shape of the spine, there can be chances of infections, right? There is increased chances of infections, right? So you weren't able to answer that fact of why is he having all these infections, because you never understood that he has scoliosis, right? So you need to always ask the medical history for sure. Like, does he have any other medical conditions that you know of? Is he taking any regular medications? Because these are the common P after questions you should definitely ask. So, and previous hospital, actually, this is partial. I'll put partial for this because you never understood the fact that he had scoliosis. And otherwise, medical history, current treatment of pneumonia, like, so why is he getting IV? Because IV is more effective as compared to oral or any other route. IV affects you immediately, while, I mean, takes action immediately. While in case of oral route, it takes a while and the bioavailability is relatively less, right? In IV, you have 100% bioavailability. So that's one of the reasons why you're giving him, because his infection is severe, right? And he's been having repeated infections because of the scoliosis. So you can understand that, that's why we need to give him IV, because even if we give him oral, it won't be as effective as IV. All right, because at this point, you don't know what medication he's on. You just know that he's taking antibiotics for pneumonia. You don't know that if the formulation will be available in IV or oral. You're making up that information. Do not make up any information at all, because if you end up making up information, then that will affect you badly, right? Work on what you have, like how much you know, like why aren't we getting. So if suppose if she asks you that, why can't you give him oral thing, and if you don't have an answer for that, always go to the thing that yes, that is an option, but I will have to talk to my senior to confirm whether we can put him on any oral. But at this point, I feel IV is what I have been told that he needs to have, and we have to give a lot of medications, right? So don't make up the information. If you end up making up information, it might come and affect you later on. So, because you don't know the antibiotics, you can't tell whether the formulation is present in IV or IM. But the real reason is that in cases of severe infections, we give IV because of better effectivity and efficacy. So that is that is one way that you can explain to them that they will work better than the other kind of formulations we have. And allergy history, actually, in cases of antibiotics, always ask allergy history. Allergy history is something you cannot miss, right? Because anytime there is a case where you have to give antibiotics, always ask allergy history, because accidentally, if you give a patient, penicillin types drugs with allergy to penicillin, it is like a medical legal case. It's a big deal. So anytime antibiotics are associated, make sure you ask about allergy. Living situations, understand a little bit about Dwight's condition. Like, how is it? Because this mother is really mad because of the fact that she has to take care of her, son suffering from CP. On top of that, she's having to come to hospital regularly. Like, she's in a lot of stress. So understand her situation. Understand how, Dwight is being cared for. Like, who is the primary carer in the family? How is this affecting you? I understand. Then you could have brought the fact that, I can get you in touch with more bodies in the NHS that can help you with Dwight's condition. Right? You did bring that up, but you don't know if she needs help. Right? So you need to understand if she does need help. Looks like she does, I would say, but it's better to ask. And social history, like who is Dwight's carer, like how is she coping with life, like Like, is she the only carer? Is she a single mother? Is she has to also probably work? So you can always get her in touch with some social services that can help her with her condition, right? Because she seems to be very frustrated at this point. Like, she has to keep coming to hospital with a son who has CP. So, you need to ease them, like, understand why they are mad. Like, once you get an idea why they are mad, you can actually give them a right kind of an answer. The primary reason you actually got that, the patient has CP and they are unable to, the attempts of IV cannula, and it's been very distressing for him. That's very good. Apart from that, explanation of why the IV infection, I would give you partial for this, because the real reason is because we kind of did make up a little fact over there, and also the fact that the bioavailability is a little higher. So that is the point that you could say. Numbing cream, you did say that, and you can say that experienced doctor. I'll ask one of my most experienced doctors who are very good at putting these IV lines to do this procedure, right? And discuss alternative medications or methods if access continues to be a problematic, while explaining that this is not as effective, right, as other alternative medication. Educate on prevention, educate on preventive measures of recurrent infections. So one of the things was like, why do I have this, right? So you can tell her that this is one of the conditions that you can have, like especially a child with CP. This is a recurrent infection possibility, and also since he has scoliosis, the shape of his chest is a little, not very conducive for proper air movement that can cause lodging of bacteria. One thing you can do is, like, whenever he's feeding, make sure he's upright, because he can always have a tendency to aspirate, which can cause the pneumonias, right? So make sure he's in an upright position. And we can always put you in touch with the physiotherapist who can give you some maneuvers to do when he is having, like, physiotherapy, the chest physiotherapy that can help with if he has a lot of sputum to get that out, right? Those are some supportive cares that you can give. Arrange for follow-up. Yeah, you spoke about the senior consultation, right? And I guess you got full marks on interpersonal skills. That was pretty spot on. You did manage to, calm her down, understand what the concern was. Like, this is the multiple effect attempts. Yeah, I'll give you, ways to reduce this the stress that Dwight is feeling. So good job, not bad. Just that data gathering was a little, off, but otherwise it was pretty good.
Please like and subscribe to TuringMedSchool. Good luck with your preparation.